Research shows that more than 400 million people suffer from stress that develops and manifests itself in the form of depression, anxiety, and consequent problems like addiction, relationship problems, and which in some cases can even lead to suicide and death. In a country with inadequate health facilities, mental health has been neglected and really badly neglected. In fact, a World Health Organization paper says there are just about 50 odd government-funded facilities for the estimated 70 million plus people living with mental health disorders, which translates basically into for every million Indian, there are just 3 psychiatrists and even fewer psychologists. Hello everyone and welcome to the Navin Times Talk from the Heart. Our guest today is Dr. Shyam Bhat, a psychiatrist, integrative medicine specialist and writer. He has a rare combination of postgraduate and American board certifications in 2 specialities, psychiatry and internal medicine. He is also board certified in psychosomatic medicine and combines these qualifications with a deep study and understanding of Eastern philosophy and healing practices, and has been called a pioneer of integrative medicine and holistic psychiatry in India. He is the founder of Nirvikalpa in Bangalore, the Mind and Body Center. Hello, Dr. Bhat, and welcome to our show. Thank you very much for coming on our show.
Thank you, Maria. Thank you for having me.
I have given a brief introduction. I'm sure there is much more to you, but you have this combination of psychiatry and medicine, internal medicine. So can you tell us a little bit about it, a little bit about yourself? I'm sure the audience wants to know more about you.
Sure, Maria, happy to do so. As you said, after my medical school, I trained first in psychiatry. I went to the UK and started training in psychiatry there. And then as I was training in psychiatry, I felt very early on that the entire body, the physiology, the rest of the organ systems other than the brain was not really being considered much in psychiatry. And so I felt that there was a real deficiency in the training in psychiatry because, one of the things is that you specialize in one area. It became clear to me though that to really understand the mind and brain, you have to really understand the body as well. And so I was really looking for a way to combine my interest in the mind, brain, as well as physical medicine. And usually you don't get to do that. After MBBS, you have to choose. Either you become a surgeon, a physician, or a psychiatrist. But fortunately, there was a few programs, residency programs in the United States, where you could train and do residencies in both parallelly. So internal medicine and psychiatry. So I was fortunate enough to get into one of those few programs. And so over 5 years, I trained in internal medicine, psychiatry, and then I board certified in internal medicine, which is basically the medicine regarding, everything from nephrology to cardiology to, so things like diabetes, hypertension, cardiovascular disease, that kind of thing. And psychiatry, which is basically about the brain, the mind and behavior and emotions. And of course, my interest was in combining the insights from these 2 specialties and understanding even more that there's a connection between the mind and the body. And in what ways are they connected? How should we think about different diseases when you understand both mind and body? And so I was really, thankful that I got an opportunity to train in that. And, that was my journey that led me to internal medicine, psychiatry. And then I further sub-specialized in something called psychosomatic medicine, which is at the interface between the mind and the body, conditions that are the interface of mind and body. And, so around the time that I began training in residency, actually a few years prior to that, I had become very interested in yoga and meditation. And that took me to an exploration of Eastern healing practices, including Ayurveda and other Eastern healing practices. And I found that there was a lot of synergy actually between the Western approach and the Eastern approach to health and healing. But the vocabularies, the frameworks, the understanding is very different. And so a lot of my work was about trying to synthesize and integrate these different elements of different healing systems, West and East, mind and body.
You have studied the mind and body connect. This Mind and Body Connect is fairly new. It wasn't there a few years ago, and today it is becoming. I mean, besides the doctors, of course, the people are now more aware that there is a strong connection. Right now, you have spoken about, and you specialize in integrative medicine. What exactly is it? How does it work? And how does it benefit people?
It's not a new thing, the idea that the mind and body are connected. In fact, all ancient systems of health and healing did not separate mind and body, and within the body, they did not separate the different organs. They did not study cardiology, nephrology, they didn't take the lung and study it separate from the heart, or the brain and study it separate from the mind, or the heart. All of these organs were considered holistically, which means you look at the whole picture. And this was true for traditional Chinese medicine, it's true for Ayurveda, and so all ancient systems of healing understood that the human body is one integrated unit and we're not separate organs, rather that all these organs are actually always influencing and interacting together. Western medicine, the greatest developments in Western medicine came because Western medicine took the perspective that let's look at each of these organs and go deeper and deeper into each organ. So if, for example, and that's what the research, that's how research progresses in Western medicine. And so what happens is in Western medicine, you have more and more specialists. In other words, there was an old joke that you learn more and more about less and less until you know everything about nothing. Because you go from an ENT specialist to a nose specialist to a left nostril specialist to, so that's the thing about Western medicine. You get, I'm only half joking about the left nostril, of course, but the point is you get more and more specialized. And because we learn more and more about less and less, in a way you can actually learn a lot at a cellular level, at a genetic level. So a lot of insight comes from that. But if we forget that these different organs are actually within one unit called the human being, and the human being is also not separate from the world around them in terms of relationships, environment, nutrition, and all of that, if we forget that, that's a problem. So Western medicine has learned a lot by deconstructing the human body, by understanding things at a smaller microscopic level, and also by having what we call an evidence-based approach to medicine, which says that just because something seems reasonable, it may or may not be applicable until we study it in a research trial. And in the research trial, we can compare what we do with a placebo or a sugar pill and see whether or not, in fact, this has any benefit. So those are the advantages of Western medicine and Western science. But the disadvantage clearly is that you're breaking down the human being into individual components, and we find that that's not adequate for treating the whole individual. So integration means that you get the best from every system of medicine. You learn the vocabulary, the understanding, the frameworks of different systems of medicine, whether it's Western medicine, Ayurveda, yoga, meditation, and so on, and you put it together for the particular individual, for the particular issue that they are facing. So integration means integration of mind and body, integration of the way different organ systems work, integration of different systems of medicine from East and West, and integration of different practices like lifestyle practices, nutrition, etc., along with whatever conventional medicine would talk about. And it takes the perspective that anything could be useful, but you have to understand it and make sure that it is indeed useful and that it's not harmful for the patient. The other benefit of integration is that you're not, wedded to one ideology. So in other words, when you go to an Ayurvedic person, the Ayurvedic person is likely going to tell you that their treatment, the Ayurvedic treatment, is going to help you, and don't go to the Western medicine person. If you go to the Western medicine doctor, he'll tell you, hey, don't do this Ayurvedic stuff, take this medicine. Right? So everybody, because they've trained in one particular specialty, becomes a little guarded about their own field. And not guarded, I would definitely say that, you start thinking that approach will fix everything. When there's many times you bring together insights and practices and treatment techniques from different medical systems. And that's also a huge benefit of integration. So this is what integrative medicine is about. And so when you look at specific diseases, the approach is quite different. Because when you understand integration, you understand that there's no such thing as a mental illness and there's no such thing as a physical illness. Everything is mind-body conditions. Let's take something that you might think of as a physical illness. For example, diabetes. Do you think it's a physical illness? Most people do. But when you look at the data and you look at what happens with people suffering from diabetes, you see a couple of very interesting facts that if someone has stress, their blood sugar control really goes down. It's not as good. If they're not sleeping well, their blood sugar control is not good. We know from data that people with diabetes have almost 50% increased risk of suffering from depression, from clinical depression. And we know that those suffering from depression have a 200% risk of suffering from diabetes. So is it a mental illness or a physical illness? Clearly, it's both. If you look at depression, is depression a mental illness or a physical illness? Well, you think of depression as a mental illness, but when you look at what depression does and what happens,
it affects the physical aspect as well, right?
Yeah, it affects every organ system.
Yeah.
It affects the brain, it affects metabolism, it affects blood cells, it affects platelets, it affects what we call heart rate variability, which is the rhythm of the heart. So, and the symptoms are largely are as much physical as mental: decreased appetite or increased appetite, feeling tired, can't sleep, you see.
Right.
So the point is that what we think of as physical illnesses or mental illnesses always have components of both. And integration appreciates that and starts treating all these different components to achieve real health.
You said that, you know, that earlier doctors used to, if you went and said you have a headache to a doctor, they would not immediately prescribe a pill or some sort of drug and say, you know, you take this. They never did ask questions about what's your state of mind. But that has changed. And we have seen that change very gradually, but I think that's a step in the right direction. Now, you said that you also use Eastern philosophies. Would you like to tell us what are some of the Eastern philosophies that you use in your approach to healing and treating a person?
Absolutely. So Eastern philosophies and treatment techniques, so there are many of these that we use. If we look at, so there are many different areas we would use that. So for example, if you look at the mind, what I use commonly in treatment of mental illnesses, things like depression, anxiety, and so on, is insights from yoga, meditation, as well as when we look at psychotherapy, the idea of the self as described by and experienced through Eastern practices such as meditation, and the idea of the self as a Western person might think about it. You know, the thing to consider is that most of the data and most of the psychotherapies have been written by Westerners for Western audiences for the Western mind. And the data is also largely from Western audiences and is not necessarily applicable to Indians, and secondly does not leverage the insights we've had in our country for thousands of years. So if you look at, for example, what meditation does and what you experience through meditation, it gives you a different sense of the self. And by that I mean, in the West, it's a very individualistic society. And even psychotherapy in the West can end up making an individual much more self-absorbed and in fact paradoxically increase their psychological pain, because the kind of, you know, self-absorption creates a lot of pain. If you look at meditation, it's about surrendering to the moment, and when we surrender to the moment, when we're not resisting the moment, there is no such thing as, you know, for example, who is Maria, who am I? We are the stories we're telling ourselves. Right now, we all, you know, everybody has a story about who they are, where they came from, and then who they want to be and what they want out of life. And all of these stories in the mind is the self, as far as the mind is concerned. But when you meditate, for example, and let go of past and future, there's no definition of the self. You just exist right now in this moment without definition. What does that mean, and how do I use that insight in psychotherapy? So that's one level of integration. But then there are integrations everywhere. For example, yoga we use in the treatment of diabetes or high blood pressure. Yoga and pranayama are extremely powerful techniques. Knowing how to integrate that with medicines where required, that's also a level of integration. If you look at Ayurvedic treatments, there are so many Ayurvedic treatments that are extremely powerful for the treatment of depression and anxiety. But you know, psychiatry has completely ignored Ayurvedic treatments. And so at my center in Bangalore, for example, we integrate treatments from Ayurveda. So our Ayurvedic team would assess the person, and in conversation with me, we would develop a treatment plan. So for example, a person with anxiety might get certain treatments from Ayurveda like Shirodhara, which is an ancient method of for a treatment for insomnia and anxiety, which involves dripping oil on the forehead in a rhythm, steady rhythm for 30 minutes. And for people who are trained in Western medicine, they might say, "Hey, this sounds like nonsense or
Mumbo
superstition
jumbo.
or mumbo jumbo," and just relaxes them. And I hear that, and I understand why it doesn't make sense for a pure Western medicine trained doctor. But having said that, it does work, and there's growing evidence that it works. Not for all cases. You have to identify the right person for whom it would help, and be an addition in addition to other treatments. There's some interesting research, for example, now coming out about each of these treatments. Yoga, there's growing evidence for its utility in the treatment of various conditions, meditation and mindfulness, lots of data. Shirodhara, in fact, there's some recent papers from Japan looking at how serotonin levels are increased by this simple and ancient method of oil dripping, you know. And it does make physiological sense. We can understand how it might work because there are nerves that are innervating your face, and certain temperatures and rhythms can create can sort of elicit neural responses in the brain. So we integrate Ayurvedic treatments, and then of course we have to pay attention to nutrition. Nutrition is another huge aspect of treatments, of whether we're talking about physical or mental illnesses. We know that the gut, the microbiome, the gut health, the kind of bacteria and flora we have in our gut, they're very important for the maintenance of certain neurotransmitters, and of course general body health as well, including the immune system. So paying attention to nutrition then becomes a very important aspect of integrative care, whether it is for depression, anxiety, or a physical illness. So like that, there's so many treatments, from acupuncture to body work. The other big thing we're doing, Maria, is again something that's not conventionally done in modern psychiatry, is integration of somatic or body treatments. Now,
What does that
everybody
mean,
knows,
doctor?
and this is what you're saying. Well, the point is that everybody knows, right, that you spoke earlier, you said mind body is new, but people are starting to understand it. I think that the general public has always understood mind body integration more than the medical community.
Very true.
Because everybody understands that when you're upset, for example, or you're angry or you're sad, you feel it in your body. Everybody knows that. Nobody says that, my body is not involved in emotions, because emotions are primarily a physical experience as much as a mental experience. And yet when you look at modern psychiatry, when you think about psychotherapy or medicines, where is the body being treated? They're not treating the body. We are saying we'll treat the brain, we'll treat the mind, but the body is being ignored. And the understanding from Western medicine or psychiatry is that the body will just follow. If I treat the brain and the mind, the body will become okay. And that's an incorrect assumption. The body and mind, it's not like the mind issues are causing body problems or body problems are causing mind problems. It's that the mind and body are one unit. They're one unit. And so for many years now, we've been treating the body directly also through so we have a team of people who work with the body, physiotherapists who are very skilled in body work, as well as Ayurvedic body work, as well as yoga, and integrating that with psychotherapy, with talk therapy. So for example, it's very common and every therapist will agree with this, that firstly, if you just work with thoughts, okay, so there's a school of therapy called cognitive therapy, which presupposes that thoughts create feelings, and therefore if you change negative thoughts to more balanced thinking, you'll feel good. And of course it does help to some extent, and there's no doubt that thoughts influence feelings. But the idea that thoughts are the be-all and end-all is ridiculous, because anybody knows that I can think positive, try to think positive, but I feel bad, I just can't help it. Or therapists may tell you that we are working with our clients, but somehow we can't have them articulate the original trauma or the childhood trauma that they suffered, that there are deep feelings they can't even articulate. We have to understand that a lot of stuff has happened to all of us long before we could even remember. And the first 3 years of life are very influential in forming our personality and our mindset, and yet we have no memories of the first 2 to 3 years of our life because the brain was not developed, the hippocampus was not developed. Parts of the brain that can articulate these feelings were not developed. But you had feelings. Where were these feelings felt? Well, they were felt in the body and the breath. And so for talk therapy, which is a Western idea, To say that we can access all these feelings just through conversation is ridiculous. And the Western presupposition that if I cannot talk about my feelings, there's something wrong with me is also ridiculous. Feelings are first felt in the body and then we articulate them, not the other way around. So,
Okay.
this is one of the examples of what I'm talking about where we've been influenced by Western psychotherapy and forgot and really taken it, just assumed that's true, when all around us we can see evidence that it's not true. There is a lot of data, plenty of data, saying that people in what we call collectivist societies like Asia, India, and so on, when they go through stress, anxiety, or depression, they don't feel sad or they don't feel depressed psychologically as much as their body feels tired, or they have tightness in their body, or they have pain in their body. And many people in India will not even say or feel that they are depressed or anxious. They will have chronic abdominal pain, chronic back pain, chronic neck pain, chronic headaches, chronic digestive issues, things like that, for which they've gone to different physical medicine doctors and not found adequate treatment because it's a mind-body issue, it's not a physical issue.
So are you
And
saying, Doctor, may I interrupt you? So basically, you are saying that in India, we are not as free as the Westerners to express what's going through our mind. And this,
no, no, that's exactly what I was saying earlier. The idea that somehow Westerners are more free and that's why they're expressing themselves and that's the more right way to express is not at all correct. These experiences are felt in the body right from the beginning. When you have sadness, you feel it in the body. It's the Westerner has been trained to be very psychological about it. In fact, I would argue the opposite. I'm saying the Westerner is disconnected from their body. They are more into thinking about it, and they have developed treatments to address their culture, which is their thinking rather than feeling it in the body. And we have blindly adopted it when in fact we are more in touch with our feelings. We are feeling it in the body. But when we are
okay.
trying to talk about it, and the therapists who have been trained in Western models of therapy, they assume they have to now train their patient to talk about it, that only then will they set it free. Because they've been trained that only feelings that have been suppressed in the mind are experienced in the body. What I'm trying to educate people is to understand that right from the beginning, every emotion is a mind-body experience, and in fact it's more authentic to feel it in your body. It's just that we have not developed treatments to talk to the body directly. Why are we going through the mind to talk to the body? Why do we have to articulate this non-verbal feeling? Because ultimately anger is not a word, it's a feeling. You
True.
can describe it all you like, but it's a feeling. Unless someone's felt it, you don't know what it feels. So why are we talking about feelings at the level of the mind? Only because Western culture, Western psychotherapeutic ideas, and Western psychobabble, which has infiltrated Instagram and media everywhere, is
Right.
training people to think about that, think like that. And so what we are saying in our center and in this approach is that, for example, when someone has this thing, we don't try to educate them and try to make them try to articulate it. That is a part of it. I'm not denying that talk therapy is very important. I'm not saying that at all. But I am saying that when you address the tissue directly, when you start working, when you have a body worker start releasing the tissue, we start mobilizing feelings. A person then becomes more connected with all the emotions that's coming out because we are addressing the body directly. And then we integrate that with talk therapy. So for example, a person who has got chronic pain and they're saying, I don't really feel anything in the mind, but I just have chronic pain. And I know as their doctor that this is from stress. I might talk to them and initially just get them to sense what they're feeling in the body. Then they go to one of our body workers, a physiotherapist who works with what we call the myofascial system, which is the connective tissue in the body and the muscles, and the Ayurvedic body work. They start feeling something. You'd be surprised how many times we see this almost all the time, that when the body starts being mobilized, they start getting some old memories, old thoughts, old feelings that they have not felt for a very long time. They then come to therapy and start to articulate it a bit. And then we connect that with the body, they start releasing the things. That's how you let go. When someone says let go of something, what are they talking about? What do you have to let go? Where is that stored? It's not stored in just brain, it's stored in every
Every
connected to
cell.
every part of the body, in breath and mind and brain. So you see, this is what I'm talking about when you actually work with the body as well as with the mind, as well as sometimes with the brain. That's when we see fantastic results, and that's what I think we need in our country, Maria, because so far we've ignored the body from Western medicine and psychiatry, whereas yoga, Ayurveda always got into body and mind. from the beginning of our culture, I think it was apparent to the practitioners of healers in the old days from observation that problems are always not just at the level of mind; they're at the level of mind, body,
And
breath,
body.
nutrition, relationships, etc. So what I'm saying is that that insight should be integrated with the insights we are learning about the brain and the mind from the West. It's not about throwing away either system. It's not about arguing for the superiority of either system. It's about understanding each system has a lot of merit, a lot of insight, and you bring it together. And the metaphor I like to use here for integration is the story of the blind man and the elephant. You know that story, right? The king says,
Yes.
let me
True,
call the
true.
blind
You
man and ask
you
to
touch the
distract the
different
elephant.
parts, and each one gives their own perspective of it.
Exactly. And to really see the elephant, we need to bring together all
All
these
of them.
parts that the different blind men are touching. Otherwise, as Maslow used to say, if all you have is a hammer, everything looks like a nail. You know, if I'm a brain guy, and for me everything is going to look like neurotransmitter
Something to
issues.
do with the
If I'm a
brain.
right, you know,
Right.
if so, so it really depends on what perspective you bring to it. You think that that is the issue, right?
Doctor, you have spoken about diabetes, and you said that diabetes is due to the mind and the body. There is some problem somewhere. So does integrative medicine help autoimmune conditions as well?
Absolutely. Many autoimmune conditions, if not, for example, any autoimmune condition will be worsened if a person has stress, for example. There's everything from eczema to psoriasis to SLE, so to Crohn's disease. I mean, almost every autoimmune condition is worsened by mental stress. There's no doubt about that. That's because, again, you know, we think of the mind and body as separate. As soon as you have stress, that means that certain hormones are being released. It means certain physiological changes have happened. It means white cells start behaving differently. So there's plenty of data talking about the interplay between all of these different systems, you know, whether it's the mind and gut or the mind and autoimmune system or the mind and heart or the mind and the endocrine system. So absolutely, from my perspective, having trained in both internal medicine, psychiatry and psychosomatic medicine, and looking at the data, it's quite clear that there's really no such thing as a pure physical illness or a pure mental illness. And I think all doctors would agree with that. But you know, because as I said, science is developing at such a fast rate that in order to be a specialist, you have to spend time focusing on a certain narrow area. What's important then is to integrate that with all of the other treatments and the other insights that are required for almost any condition, whether it's high blood pressure, cardiovascular disease, diabetes, hypertension, autoimmune diseases, and so on.
All right. It is time for a very short break. Don't go anywhere, and we'll see you soon. Welcome back to the Navin Times Talk from the Heart. We are in conversation with Dr. Shyam Bhat, psychiatrist, integrative medicine specialist, and of course writer. Doctor, we have been speaking about different conditions and how the mind and the body affects how we feel, how we are, the conditions that we suffer from. What and how would you explain holistic psychiatry?
Sure. Maria, see, one of the things to remember about psychiatry is that as a profession itself, it's very fragmented. So you have psychiatrists who are basically doctors who have finished MBBS and after that done post-graduation in psychiatry, where they learn, ideally, different areas of mental health care, understand the brain and how it affects emotions, what are the problems that can occur, understand the body, as well as understand psychology and the mind. And so a psychiatrist can diagnose a person, they can prescribe medicines or order tests where necessary, and depending on their level of interest and training, they can do psychotherapy, they can be therapists. Okay. Now, you also have psychologists who have not gone to medical school, their background is in the humanities, they've done a master's ideally in psychology and maybe a PhD in it, And so their training is really in the mind, in the psychological aspects, not so much about the brain, unless they're in certain specialties, almost nothing about the brain and metabolism and so on. And so they cannot diagnose in that sense or prescribe medicines. They focus on the psychological aspects, on the mind. Now, here itself, you see a problem, because if a psychiatrist is not trained in the psychological aspects, they would view most of the problems as being primarily because of brain issues, and they would intervene primarily through the brain, which is through either a certain treatments or medicines or what have you. And they may or may not refer the person for psychotherapy, but it's often not integrated. On the other hand, if you go to a therapist who's not a psychiatrist, they have not understood you from the level of diagnosis and or from metabolism or the brain, and this can have serious implications. Person can come in with anger, and they might have a thyroid issue. They might have uncontrolled some other hormonal issue, or they might have clinical depression that actually needs certain medicines even. But the therapist often would focus only on the therapy, and again, depending on their level of awareness, they may or may not involve the psychiatrist. Now, within psychotherapy itself, there's fragmentation because there are different schools of psychotherapy. Some therapists have done primarily, their cognitive model. Others may be more influenced by a psychodynamic model. And largely, though, most therapists are using Western, as I said, Western psychotherapeutic techniques based on Western research, written by Western writers and theorists and so on. And so the whole Eastern part, which is transcendence of the self, non-duality, the dissolving of the self, as I was talking about, through meditation practices, they're not integrated really with the rest of psychotherapy. Then you have the body. As I said, you have what's happening with the cardiovascular system. Maybe the person has diabetes, high blood pressure. How's that impacting their mental health condition? That's also not integrated and not unified. So at the level of understanding of the problem itself, there's a fragmentation. If the same person with depression, for example, can go to the psychiatrist, who might say, hey, you have depression because your serotonin levels are imbalanced, you have a neurotransmitter issue. She could go to to a psychodynamic therapist. The psychodynamic therapist would say, you have depression because you had a tough childhood and there were some attachment issues with your mother. They could go to a cognitive theorist who would say, you have depression because you have negative automatic thoughts. They could go to a trauma specialist who who sees this primarily as an issue of trauma. You see what I'm saying?
So by the end of it, basically, doctor, by the end of seeing these specialists, I think the person will be more depressed than anything else. Right?
No, they're not going to see specialists. They will see one, and depending on the specialist, they'll get a certain perspective of it.
I'm just saying that it's so confusing because for you to identify whom am I supposed to go to? I'm feeling low, but I don't know. It's very confusing for a lay person. I don't know what to do. I remember I had this problem and I said, I'm not feeling too good. I'm feeling low. Now, what do I do? And everyone came up with their own idea. Because as a layperson, it's very difficult to understand the difference between these specialities. So,
100%.
Yes. So, how would you say, how does a person like me, decide on the type of specialist that I need to visit?
I mean, firstly, I totally empathize with anyone trying to navigate the mental health system. You're absolutely right. You'll hear that, hey, the psychiatrist will help you, the therapist, this therapist, that therapist, yoga, meditation, Ayurveda. Totally confused.
Counselors.
Yeah, counselors, etc. Now, ideally, if you're feeling low, the best person to go to is, in my view, is a psychiatrist who's also trained and also very interested in psychotherapy, and who would not, so a professional like that would be able to assess and determine whether this case can be resolved through counseling and therapy, or does it need anything else, and hopefully they'll be able to do the therapy. But that's very ideal, Maria, because the world over now, psychiatrists have reduced their involvement with psychotherapy. To the extent I think a lot of the public doesn't even know that therapists is a function, it's not a qualification. Therapist means a person who's doing psychotherapy. That person could be a PhD in psychology, a master's in psychology, a bachelor's, a social worker, or a MD in psychiatry. It could be any of those. And they all bring different perspectives to it. So that's ideal, right? Seeing a psychiatrist who's also a therapist. Now, if that does not, and that's usually not accessible or you're available, that professional, then I would recommend, depending on severity, you decide who to see. If it's a mild issue to not too bad, a moderate, then see a psychologist, a therapist, who would start working with psychotherapy, but who also works closely with a psychiatrist if necessary for referral. And so that's very important. The second thing is to see a therapist who you feel a lot of comfort with. You feel like they understand you, they get you, they're really interested in your well-being and are very professional. That's very important for you to identify. So those are the main thing I would say is see a therapist, a psychologist in other words, who unless it's severe, and by severe I mean causing such severe dysfunction that life itself seems difficult, or
You cannot function
you,
properly.
yeah, you're having significant trouble at work or in your personal life, then see the psychiatrist first.
You said work, and I think that is an area where a majority of us, are having problems. Work is so stressful today, and we have so many responsibilities, and with those jobs and responsibilities, the stress level is really, really high. Every second or third person you ask has stress at work. So how do we deal with this? Not just as an employee, what can employers do to make it easier for the employees and bring down the stress level? Because finally, it doesn't help just the individual, it's helping the company as well.
Absolutely. Maria, even just from a pure bottom line perspective, it makes sense for companies to take care of their employees' mental health. There's lots of data around this. Most of the data is from the West, but it would apply to us that for every dollar spent on mental health care, the company makes $5 to $10 in extra productivity and so on and so forth.
Right.
There's out that a mentally well workforce is more motivated, happier, more engaged, more productive. And so even from a purely financial sense perspective, it makes sense for companies to take care of their employees' mental health. And post-COVID, of course, I think it's become all the more important because people are struggling and people have become very sensitive to whether or not companies are taking care of their mental health. The young employee, the millennial, the Gen Z kind of employee is very, in that sense, much more aware and more proactive about taking care of their health and expect their company to have a work environment that would allow them to actually nurture themselves and get enough time for their self-care and for their mental health as well as physical health. Companies, therefore, I think whether from a financial perspective or employee retention perspective or just from an ethical perspective, from all these perspectives, it makes total sense for every company to really be investing resources in mental health care. Now, what the company can do is firstly have counselors available who are accessible to their employees and who are paid for by the organization, at least a few sessions for every employee. Of course, a lot of companies do this, but even then, I'm seeing that the employees don't often take advantage of that. A lot of companies have that, but employees won't access that. And so the company then I would encourage them to do awareness workshops, talks, so that their employees become more aware of why they should take care of their own health and not
Doctor,
have
there is a stigma. There is a stigma. If I go to a counselor, people are going to look at me. They're not going to look at me in the right light. They will consider me below par. They will not, look at me in a role of a leader, maybe. So this is that stigma that is there. You're right. It is not just in. At the workplace. Talk about schools and colleges. There are counselors. Schools and colleges do keep counselors. But how many of our children utilize that service? So yes, awareness programs, what you're saying, is so much needed. Right. Please continue, Doctor.
No, absolutely right. The stigma prevents a lot of people from seeking help. I always remind people that if you had a fever for 2 weeks, you'd go and see a doctor. You wouldn't wait. But people are running around and doing their work, and I feel really bad with depression, significant symptoms of anxiety day after day, and it imposes a lot of suffering. It might be harder to wake up, harder to focus, harder to feel happy, harder to do things of that just everyone is entitled to feeling good, in my opinion. And if someone is not feeling good, and that happens week on week, and unfortunately month on month and year on year, that's something that we have to change in our country. And the way we change it, one of the big ways we change it, is by getting people to be more aware of what this is. Depression is not weakness. Depression is not laziness. Depression is not sadness. Depression is not a choice,
It is an
Depression is a
illness.
complex condition, an illness, like any other condition, which is complex, which has mind and body issues, which needs treatment and which can get better. So we still have a lot of work to do in terms of
Oh
awareness
yes,
building for
yes,
sure.
we definitely do. But doctor, I'm not sure about the name, but there was a scheme. It was a health insurance scheme of the government. I think it was Ayushman or something, which also included mental health. I mean, for the first time, something like that came about. However, I think the sad part about that scheme was that you could get that kind of treatment only in government hospitals and not public hospitals. So what happens is there are just so few hospitals that government hospitals that you can go to. So I really am not sure what happened with that scheme, but I think even health insurance companies should take into consideration mental health, because I haven't heard of too many companies that give mental health as a part of their package. It's everything except this. So yes, you're right. I agree with you when you're saying we have a very, very long way to go. Now, doctor, with all the
Things have
social,
changed. I think you're right. The Mental Health Care Act, the which was passed a couple of years ago, is really a huge step in the right direction. And I think there's a growing recognition, by everybody, including government and doctors and society, that mental health care is extremely important, and that it's one of the single biggest healthcare challenges facing our country. It already is one of the biggest healthcare
it
issues
is,
facing our
it
country.
is.
So people, I think things are moving in the right direction, but obviously it's a huge problem, and we have a huge population, and so it's going to take a lot of consistent effort to get to where we want to be.
Right, right. Now, due to social change in India, it says that almost about 35% percent of people have suffered from some kind of depression, and 20% have major depression orders. Now, this is, it indicates a sort of an epidemic that is there. What about the youngsters? Do you feel that the youngsters too are heading towards this? And if they are, what is it that we can do to
Right.
to slow it down, or and even stop it in the end? How do we go about it?
Yeah, there's no doubt that youngsters, adolescents, children are suffering more than previous generations. We know that from the data, because suicide rates have gone up significantly in that age group,
Right.
to the point that it is one of the leading causes of death for people between the ages of 15 and 39. So that's a huge issue. And of course, the reasons are, all, I can list out the reasons, but there are many. I mean, it's so many things are happening in the world today that are making it more difficult for children and adolescents to stay mentally healthy.
Right.
Whether it's technology and social media, the impact of this whole digital life on the brain and on the mind and on relationships, the impact of COVID recently, the rise of pollution, the absence of nature, the overwhelming increase in internal and external pressures and demands, because we live in a world where everybody wants more and more and more. So
True.
there's a lot of dissatisfaction. People are getting lonelier. People's lifestyle is changing. They're exercising less, eating worse food, often fast food or restaurant food. You look at all of these factors, and it's not surprising that, because every one of these things is known to increase the risk of depression and anxiety. All of the things that I talked about just now, and that's not an exhaustive list. There are lots more. So when you put all this together, it's not surprising that young people today are suffering emotionally in a way that previous generations haven't. It's not because they're weaker. It's not because the genes have changed suddenly. It's because the circumstances, the environment, the culture, society, and the natural environment has changed considerably. So that is the situation. Now, what can we do about it? Well, clearly, again, this means involvement of every stakeholder here. Parents, particularly parents, schools, government, and of course, children and adolescents themselves. So so we have to have more awareness, more education. In fact, I think mental health and how to prevent mental illness, because these are preventable conditions, this should be part of every education, of all, of educational curriculum. It shouldn't be something that is taught by a therapist if we have a problem. Every child needs to learn this. Every adult needed to learn it. We just didn't learn it in our time. But we, perhaps our time was a little easier. But for children today, adolescents today, I believe it should be part of the educational curriculum, and I think they are much more interested and more aware than previous generations, and they actually have less stigma than previous generations, which is a good thing. But they need know-how. They need a little more insight. What are the practices you can do? How can you handle your thoughts? How can you handle relationships? How can you handle your feelings? Why do you need to exercise? What about meditation? So many things. How do you handle disappointment, failure, expectation? These are things that every child needs to learn, and yet we don't teach that in school. We just teach them studies, and we don't teach them how to handle their own mind and how to handle life. So that's really important. Parents need to be educated how to raise their children to be more emotionally intelligent and happier children. Um, the work, rather, the schools have to be educated. How do teachers handle students? How do they handle their own emotions with students, and how do they create an atmosphere of learning as well as acceptance and nurturing? So they also have to be involved. So we need, each group has to be involved, and until we get to a point where the child is raised in a way that they're given the tools for mental health, the support, the encouragement, and the right role models as well.
So to translate that, basically it has to be an integrated effort from all quarters to get our children to be better people, better human beings, better citizens, and happier people.
As they say, it takes a village to raise a child. So it takes everybody.
And today we are a global village, so yes, I think the help needs to come from all quarters. You have given the different topics, and you said meditation, how to handle disappointment, etc., etc. If you, I'm putting you on the spot, if you were given and asked, which is that one, the most important topic that you would talk to and explain to teenagers and even children, basically, college students, students and children about mental health, what would that one topic be?
I cannot tell them only one thing, because that would be inadequate and it would not be true. That you can do one thing and everything will be fine.
No. I'm just saying that what is the first thing that you would start with, which you think is very crucial for them? Because you see, what happens is with students today, they have so much to occupy their mind. There's so much else, something much more interesting, which is much more engaging for them. So when you start talking to them about mental health, the first thing they do invariably is roll their eyes. And then the second is like,
much more credit. Yeah, the young people I'm talking to these days are very much more aware than we were. We would roll our eyes, I think, back in the day.
Is it?
But yeah, I think so. I think young people today, if you look at Instagram, if you look at what they're reading and what they're following, there's a lot of interest in mental health, in how to handle feelings. Why am I feeling this way? They are probably the most aware generation I've seen, actually, to be honest. But of course, adolescents being adolescents, few of them will roll their eyes. But I think the first thing is to really help people understand that it is important and vital to their well-being to start paying attention to their mental health. That's the most important thing, that a person has to be aware that we are not talking about something good to have, we are talking about something essential to human health and happiness. That if we don't know how to handle our minds, our thoughts, our feelings, then we're not going to be well. And in order to fulfill our potential, we need to, have a good mental health. So there's no one practice, because clearly mental health, as I said, is an integration of multiple practices. And an adolescent, just like an adult, should be looking at their sleep, should look at getting enough exercise, should be eating the right food, should reduce using social media and digital content so much, and spend more time in the real world. And there are no two ways about it, that all of those things are important to have mental health. So I think the first thing I would tell somebody and try to help them understand, if they don't already, is that, look, your mind is one of the most precious resources you have. Your mental health determines the quality of your life, what you can contribute to the world, and what your legacy is going to be, or, well, they're not thinking legacy, but certainly, whatever you're going to achieve tomorrow is because of your mental health. And that is why we have to take some time every day in doing things that will help your mental health. It could be exercise, yoga, meditation, spending time in nature. There are multiple things. So that's the first thing I would try to communicate, that your mental health is important. The quality of your life depends on it. That you have the capacity to have great mental health and mental resilience. And then with that curiosity, that interest, that awareness that it's important, you can do and learn many practices.
Right. Doctor, just one more question. And the most important one is that you have developed integral self therapy. How does it work and who can best benefit from it?
I developed integral self therapy about 15 years ago, and I published a few papers while I was in the US, and then I came back to India, where I left academia when I moved to India because I wanted to come back to India to really try to contribute to mental health in this country. By the year 2010, it was clear to me that mental health is a big issue in our country. And so integral self-therapy is a therapeutic approach that integrates insights from Western psychotherapy and insights from Eastern wisdom, including the ideas of non-duality or transcendence. And non-duality is the ancient insight that the self, as I was saying earlier, is a construct of the mind. And that, in a sense, the metaphor we use in meditation and in the Eastern philosophy to describe the nature of the self is that you are like a wave in the ocean. You think you're separate from the ocean, which is the universe, but you're not. And just like the wave, we come and go. But we are eternal in the sense that we are always part of this universe. Now that sounds metaphysical and philosophical, but it's very real in the sense that you can experience things in meditation that give you slightly different perspectives on who you really are in this universe. Now, how do you integrate that with conventional Western psychotherapy? That is what integral self-therapy is about. It allows a person to enjoy what they're doing without being so attached to outcomes that they're suffering the consequences of that, because one of the single biggest problems for human beings is that we don't control the world, we don't control life, and yet we desire so much. And so most human beings live a life of constant tension, constant stress, dissatisfaction, uneasiness, because this is a life that is outside your control, and you have so many needs and so many desires, and ultimately we are aware that we are not here forever as well. So these are basic human issues for which answers were already there in spiritual traditions, but it was not easy to integrate that into a therapeutic process that would help people achieve the state of attachment but detachment, the state of being here fully, but also understanding that
you are here for a short time.
Exactly, but that's not a terrifying thing. That's a feeling of exhilaration and liberation, much in the same way that you'd play a game with a lot of passion and a desire to win, but at the end of the day, you know that it's only a game. We take life too seriously when we are not aware of the transcendent, transpersonal, larger aspects of existence in life. So integral self-therapy is a way of integrating these two ideas, these two perspectives, East and West. It's best used for people who want to self-actualize, self-realize, to go beyond so it's not really, I don't use it as much for kind of more severe depression, anxiety, but once a person starts then moving from there to a state of health, I use this therapy to take a person from depression and anxiety into a state of self-actualization, self-realization, because I see all of that as one continuum. I don't see people who are suffering from depression and anxiety as any fundamentally different from a person who is not suffering from that. It's just a line where we draw a line arbitrarily at some place and say this is clinical depression and this is just,
and this is not.
Right. This is not. But in fact, when you look at the continuum of human suffering, it's all a spectrum. It's a continuum. And so in my philosophy is that we may come into treatment or therapy to treat depression and anxiety, but the goal ultimately is not just to treat depression and anxiety, but to allow a human being to be more fully who they are, to be completely who they are, to be liberated in that sense, so that they can actualize completely this essence of their being, and that is ultimately what I see as mental health, the full flowering of human potential, and that's the goal of integral self-therapy.
So when Dr. Shyam Bhat is feeling low, and how does he get himself out of it? What exactly is it that you do? Is there any trick?
Right. Depending on what's happening, I think as all like all people who work with people and emotions, we do absorb in psychiatry.
Of
We
course.
absorb a lot of
Of
feelings.
course.
My days, it typically will be hearing a lot of pain, and I have to feel the person's pain in order to help them. So I do feel, in that sense, the lows of my patients, their fears, their all of that at a visceral empathic level. And of course, that can cause you to be emotionally exhausted. There's no doubt about it. And the process I follow, and I try to do that every day, and most days I do, includes yoga, meditation, breath work, sort of connecting with my own inner center, releasing these feelings. It is a process, and if I have a busy day and I can't do it, then I do accumulate it, and I have to be aware of it and let it go. In all of this, one of the key things is acceptance of what you're feeling, breathing, and then sending some self-compassion your way and compassion to others and letting it go. I think a lot of people think that firstly, if you feel low, there's something wrong. I don't even see feeling low as anything wrong. It's feeling sad is a part of human experience. If I didn't feel sad for the person who's suffering, then I'm not a human being, in my opinion. I mean, it's a normal human thing to feel sad, either about what's happening in our life or somebody else's life. It's also a normal human experience to feel happy. And without the sadness, I will not understand my happiness, and vice versa. So a sense of acceptance of whatever one is feeling, a sense of compassion, patience, kindness, and integrating mind, body, and breath is what I do even when I'm, working through whatever I have absorbed or whatever I'm feeling. And the kind of philosophy I use when I'm working with others, it's not very different.
Thank you, Doctor. You have given us so much of information, and I'm sure all of our viewers who are watching have learnt a lot. As Doctor said in not too many words, there is a light at the end of the tunnel. It is not the end of the world. And yes, we all do feel low at some time. Doctor does himself. So it is not bad. All we need to do is understand and be aware of it, and then take the next step and go and see someone who will help us out with it. Mental health is everyone's business. It is not just yours or not just mine. So let's make it everyone's business. Thank you, Doctor, for joining us. We've learned a lot. And I'm sure we're going to assimilate all that in, every day, in all the things we are doing. As you said, awareness. And we hope to talk to you soon. Do come back on our show whenever you have the time. And thanks again. All the viewers, thank you very much. Thanks for your patience, for your attention. Until next time.